Hello, and welcome back to Your Health, Your Wealth. I'm your host, Eddie Patton, and today we're going to talk about health decisions that affect not just our bodies, but our time and our use of the healthcare system. Have you ever left your doctor's office and you felt rushed, like you just kind of nodded through the discussion and didn't really get your point across or really understand the different treatment options? And on the flip side, have you ever been to your doctor's office and was told that, hey, we're just going to do A, B, and C, and left there not really understanding, what just happened or what am I really supposed to do? Well, today we're going to talk about a topic that is not very popular and it may not be the most exciting, but I think when we look at this topic of shared decision making in healthcare, it can really save us a lot of time. It can increase trust in both the physician and the healthcare system. And in the end, save when it comes to healthcare dollars by not doing unnecessary tests and making sure that we're best utilizing the healthcare system. So today we're going to talk about shared decision-making in healthcare. In my view, is one of the most important ideas in modern medicine because it has to do with figuring out or choosing the best choice. And with all of the different tools at our disposal nowadays, we have search engines, we have AI-derived search engines now that we can go into and check. This whole concept of shared decision making is becoming more and more important. It's almost daily that I'm in clinic where someone comes in and they have put their MRI report into ChatGPT or Perplexity and come out with the itemized write-up on what it means and treatment plan. And so this concept of shared decision making is the shared discussion and actually making the decision with your doctor and not letting your doctor making that decision for you. So we'll dive into this and I'll give you some tools that you can take into your daily life and into your clinical visits with your doctor to best figure out the best treatment for you. So when we talk about shared decision making, what does that actually mean to both the clinician or the patient? We as doctors and nurse practitioners and the treaters, we bring the medical expertise, we bring the evidence, we bring the different options. But when it comes to the patients, the patients, they actually have their life experiences, their different things that we don't know. So this concept of actually talking during the visit, coming up with the treatment options together, that's why it becomes more and more vital, more and more important. There are a couple of things, simple questions that we try to answer. Number one, what are the options? And when I engage in shared decision making during my clinical visit, particularly when we're talking about treatment options, I like to outline all the different options, or I'll give my opinion as far as what I think would be best and why. And then I want to hear from the patient, which one do you think is best, or what do you think is best based on your lifestyle? Because the other important thing is what are the benefits and the risks of each option? And then what option makes best sense for your life? For instance, there may be, like in a condition like multiple sclerosis, there may be pills or oral medications versus IV treatments or intravenous, where you have to go into an infusion center or have a IV nurse come to your home. Well, there's some people who say that going to an infusion center or getting an infusion would not work with my lifestyle, so I would prefer a pill. So that's a part of the shared decision making that goes on. Why is this important? When I think of the historical nature of healthcare and how decisions were made, historically, healthcare decisions were largely made from a paternalistic standpoint. So that means that you come in, maybe a diagnosis is made, and the doctor says, this is what we're going to do. Well, more important, this is what you're going to do. And just because I know, I've been in training and everything else, so this is what's best, and this is what we're going to do. You can also have that same concept from the other side. Like I've been in a visit, and a patient comes in and says, hey, doc, this is what I think I have, and this is what I want you to do. And I may spend 30 minutes to an hour explaining to the patient, either one, why I don't think they have that diagnosis that they think they have, or two, why the treatment that they feel is best for them may not be the best treatment. So the paternalistic aspect works both ways. But when you come up with when you use this concept of shared decision making, it becomes more of a conversation as opposed to me just telling you what to do. Nowadays, choices are not always just black and white. There are different options. Even if I say that this class of medications they may be the best class of treatments, there may be 4 or 5 different medications within that class. So how do we choose which one of those is best? So we look at which medications, and or even if we need to do medications first, maybe there's some lifestyle changes that can be made and we can avoid medications. And, for some reason nowadays, especially with direct to consumer marketing, people are fixated on them. They want to go straight to the latest, greatest medications. But after I explain sometimes side effects and just that there's certain lifestyle changes, whether it be exercise, dietary changes, vitamin supplements, there are other lifestyle changes that we can make that may help where we don't need to go to these treatments. I also see this a lot when we're talking about surgery versus conservative management. I treat a lot of back issues, and it's a tough conversation when you have this person that's been in chronic pain because of, let's say, a low back issue, and they have some lumbar spine disease, and they may see one surgeon that says we need to do surgery, and then the other surgeon that says no, just do some physical therapy and let's do conservative management. And they come and sit down and say, hey doc, what do I do? Do I have surgery? Do I just do physical therapy? And so that's the time where we sit down and do the shared decision making, where we go through all the options. And I say, hey, how bad is your pain? How is this impacting your life? What are the other risk factors you have that may make surgery more complicated? So those are all the types of questions we look for in making this joint decision, and making sure that decision will align with your life, will align with what you're trying to accomplish in your goals, as a patient. Now, it's not as easy as it sounds, because there are different things, different barriers that may impact this ability towards shared decision making. Some people are nervous, they're worried. They want you to just make the decision for them. And sometimes I'll break up a visit. For instance, if I'm given a new diagnosis, and we're reviewing results and doing all of that, it could be a lot of information at one time. And this can be overwhelming for patients. So that may not be the time to really dive into the different treatment options that we may need to discuss, because they're just, it may not be the best time for psychologically and mentally. So we may break that down. I say, hey, well, let's get back together. Giving you a lot of information today. Let's get back together in the next week or two, and we'll talk about different treatment options and how we'll move forward. Especially if it's a chronic condition that's been going on for a while, you don't have to make that decision right then and there. So we can take some time, go through the options. I may give you some information on different treatment options. Say, hey, go home, read up on these couple of things, and then we'll do a telemedicine visit, or we'll come back together in a week or so, and we'll make a decision together as far as how we want to move forward. There can be other issues like language barriers or cultural barriers. There's certain cultures where the kids, for instance, or the children will come and they'll say, hey, we don't want you to discuss all of these results with mom or dad, and just make a decision. And that's how we do it in our culture. And so, I have to decide ethically and according to HIPAA and healthcare information, what's best for the patient, because we have to disclose some information, but I also want to be sensitive to different cultural differences and how people handle healthcare in different cultures. So I try to prepare beforehand, and so that I'm aware and understand that different cultures handle healthcare information differently. And so as a clinician, you have to be aware of that, be cognizant of that, and be thinking about that as you're going through and talking with a patient and their family about their condition and how you're going to move forward. Language, you have to use interpreters. You have to make sure, and I'll reinforce and ask the patient, do you understand what I just said? Or what do you feel about what I just said? Because I want to make sure that you're getting what I'm saying, and that there are no language barriers, and that you're not embarrassed about any language barriers or issues, or even in the understanding. I try not to use a lot of medical jargon. I try to break it down into plain literature, so that there is a clear understanding, because I want you to feel empowered as a patient. And yeah, the key word that I would say there is empowered. It's shared decision making is a way in which you can take back the power, take the power of your healthcare into your hands, and coming up with these decisions with your physician, not just them telling you what to do. When we look at shared decision making, there's a role that I have as a physician, as a clinician, and there's a role that the patient has as well, or the family has. So it's my job to explain the options clearly. And this takes the most time, and especially in today's environment where we're looking at shorter office visit times, sometimes we're rushed to get people through. This can be hard, and sometimes we have to break up the visit to make sure that we give all this information. Because particularly if you're talking about a condition like multiple sclerosis where there are over 30 different treatments, it's my job to explain the options. And I may say, hey, we're not going to even talk about these options because it's not that bad, so let's stick with these 5 options. But it's my job to explain the options. I want to be honest and specific about the benefits and the risk, because just because I give an option, that doesn't mean that I think that's the best option. Or I may say, look, things aren't that bad right now. Let's just continue to monitor for another 6 months or so, and then come back together and see if we can, we'll talk about these options, see what's best. One thing that frequently overlooked, though we don't do enough, is talk about what happens if we don't do anything at all. We're in this modern era where we have so many tools at our disposal. We automatically jump to that. We have to do something. But in some situations, you don't have to do anything at all. And it's the patient's choice if they don't want to do anything. And ethically, it might not feel right, or you might say, no, let's, try to push to do something. But it is that patient's right to decide how and when they want to move forward with whatever options they want to do. And doing nothing is an option. We see this in, for instance, cancer treatments where sometimes patients refuse care. But we have to remember that is one option that a patient has, and it's It's your health. It's your body, and you have the capacity to make that decision if you want to refuse care or don't do anything when it comes to your care. So as a clinician, I also like to invite questions, making sure that people understand fully what we're talking about, and I can give them live feedback. It's my job to respect your priorities. Whether that be these medications are too expensive right now, I don't want to do it, or maybe can you put me on something else just because my priority right now is getting my kids through college. And so it's my job to respect that and to be able to offer treatment options or do different things to make sure that we accomplish your priorities as the patient. And I also don't want to push my decisions as opposed to advising certain things and then coming up with a decision together. But, the most important thing is provide that medical knowledge, but medical knowledge alone, that's not everything. It's a conversation about effects, about costs, recovery times. A great physician works with the patient, talks about what is medically possible, what it matters to you, and then collectively comes up with a decision. From the patient side, there are a couple of things that you should do to be prepared. There are different questions that you want to ask based on what your physician wants to do. How is this going to affect my lifestyle? What's the cost of the medication or treatment? And your physician may not have those answers up front, but it's nothing wrong with saying, hey, I want to make sure that this medication or this treatment isn't going to put me in a hole, or I want to do physical therapy, but I don't know if I can take that many days off. So is there an option or something at home? Ask about side effects. And so these are the different things that as a patient, you can come prepared, and your care team should be open and willing to discuss these things with you. You don't have to feel, or you shouldn't feel judged because you're asking about things like costs or preference. It's your life. It's your lifestyle that's important. So when it comes to shared decision making, remember, this is your doctor's visit. This is your doctor's visit. This is your time. So you have the right to discuss these things with your doctor and come up with the decision together. So here are some things that I think when it comes to shared decision making that you can bring to the visit to discuss with your doctor. A couple of questions. What are my options? When we look at the total treatment paradigm or what we're trying to do, the decision tree, what are the options, and can you explain those to me? And don't be rushed and just tell me what you want to do. Tell me all the options, and then we can make a decision together. What are the benefits? What should I expect? And that way I can know if I do this option, what should I expect as far as if it's working? What's the timeline? Should it work in the next 2 weeks, or do I have to wait 6 months before I see some type of clinical benefit? So that's another important question to ask. What are the risks? And then what happens if I don't do anything right now? And then which option fits my goal, budget, and lifestyle? So keep notes, take notes. I personally don't have a problem when my patients bring out their iPhones or notebooks. And that's why I love doing this podcast, because it's a way to add the information too. So I'll even refer patients to the podcast, different episodes, to say, hey, I know that we only had a limited amount of time today, but go to this podcast and listen, because I expand on a little more detail when we talk about treatment options. As a healthcare provider and someone that's trying to provide the best care possible, it's not always easy to implement this shared decision-making model. There are a number of things that stand in the way or barriers. Probably the most important, or the thing that stands out the most, is the short appointment times. I constantly feel as though I'm running out of time with my patients, or have a short amount of visit times. And when that's the case, or when a physician has to schedule, then it limits the amount of time that you have to really dive deep into a number of these decision models when we're looking at a decision tree and what we want to do. So that's where you have to start using other things outside the box, like, other resources like this podcast, or for instance, my website, have information available on the website. So, if it's a test you want to run and they have a lot of questions, okay, well, go to the website and there's all the information you need there. Since we can't really go into a whole lot of detail, but definitely short appointment times. I also have to be careful about using medical jargon, a lot of terms, because a lot of times patients, they don't want to feel ignorant or so a lot of times it's like a nod, but so let me reframe that, or let me put this in more common terms, because I know that I just use a lot and sometimes medical jargon can sound like a different language. So we need to make sure that we're putting it in a way in which people understand. There's fear or patients feeling overwhelmed during the visit. And that's when you have to know how to read the room. There have been times when I've been given information, I can see that a patient or their family is just overwhelmed. And at that point, I just stop and say, hey, let's just take a minute. I've given you a lot of information. We can take a break, or we can come back. I can let everyone digest this, and we can pick back up at another time to talk about moving forward. So, you have to know how to read the room. You have to know how to pay attention to patients if they are feeling fearful or overwhelmed. The other thing is culturally, we have to be mindful that some people have a low health literacy, meaning that they may come from a socioeconomic background where it's a lot to understand. They may not go to doctors or have seen doctors a lot. So if they come in and you start really going down a number of different things, well, I want to do this, I want to do that, I want to do this, it may just be overwhelming, and that can sometimes push someone away to say, you know what, I'm just not going to do anything, especially when you don't put things in a way that culturally he or she can understand. So really understanding these cultural differences and ways to put the medical information in a way that you're sensitive to a patient's cultural differences. Cost concerns as well. I love medical economics, so I'm often talking to patients about, hey, this is what this is going to mean to you. And even if you're talking about something as simple as physical therapy, well, you have to look at the time you have to miss from work. Now, you can't schedule appointments after hours and that kind of thing. But you want to be able to go over those different cost concerns with your patients as well. And the last thing would be like limited access. Sometimes you just don't have the treatment options at your disposal to be able to use for that patient. So maybe the patient lives in an area where geographically they don't have access to infusion centers or different things like that. So that can be a limitation to their therapy as well, and something that you have to take into account. But ultimately, for patients and for clinicians, there are a number of things that we can do better, and how we can really incorporate this shared decision making into our daily practice. And overall, I think that will improve healthcare and decrease costs, because you're not ordering a number of unnecessary tests. Sometimes patients come in and they say, hey, doc, I've been on ChatGPT, or I've been on Google searches, and this is what I have, and this is what I want you to do. I want you to order an MRI of this, and this. I want you to order this labs. And I have to say no, because that's not cost-effective medical treatment. And so I don't want to just order a bunch of stuff when I already know, based on my clinical exam or history, that it's not A, B, and C. So it works both ways, and that's why it's called shared decision making. But What I try to do in summary is just use plain language. I use visual aids as much as possible because sometimes you can conceptualize it better when you see it as opposed to me just telling you. So if I'm showing you what's going on in your low back because of a bulging disc, if I just pull out my iPad or I use my model, you can conceptually see it a lot better than me telling you. So the overall goal of shared decision making is not to make visits longer, but to make sure that I empower patients or that you feel empowered in taking care of your health and making sure that you know all the options, that you know what to do, and that we can come to this decision together. And this has an impact even on the bottom line when we talk about healthcare finance as well. From a financial side, when people really understand their options, they can avoid some of these unnecessary tests, procedures, and these treatments that don't actually work. So this can reduce a lot of wasted spending when it comes to healthcare, and that decreases the bottom line or financial stress on patients. A good healthcare provider should not just improve outcomes, but should also fit into a person's life and not create any unnecessary burdens, whether they be physical burdens or financial burdens as well. So in closing, if I wanted to just kind of sum up a couple of things that I'd like for you to just take away from this episode and this whole concept of shared decision making, it's that number one, you deserve to understand your options, and you should be clear on those options, be able to come up with a decision as to the best option along with your physician as a part of this model. Number two, you deserve to ask questions and have the time to be heard. So come prepared, ask questions. Now, that doesn't mean you may not be able to ask, 100 questions. But hopefully your clinician has allotted that time to be able to allow you that time to ask those questions. You deserve to be a part of the decision when it comes to the care that you take and that is provided for you. So be an active listener, be an active part in this shared decision model. The next one is when you think about shared decision making, it's not about challenging your physician or the expertise. It's about best using that expertise and working with your doctor so that the two of you work together to come up with the best treatment for you. And last, when patients and clinicians work in partnership, decisions can be clearer, they're more personal and more sustainable, which ultimately, in my view, will lead to better healthcare outcomes. Thank you for listening to this episode of Your Health, Your Wealth. If today's episode helped you think differently about healthcare conversations, how you approach your visits coming up, how you prepare for your visits coming up, take one question with you to your next appointment and use it to employ this model of shared decision making. And remember that, good care is not just about what works medically. It's about what works for you and for your life. So I'm your host, Eddie Patton, and I appreciate you tuning in. If you enjoyed this episode, please share it with others and tune in for future episodes of Your Health, Your Wealth.